Dentist treatments can worsen your health and cause more cancer. If you want to prevent cancer, you need to learn how to take care of your dental health. In this video, you're going to learn about the corruption going on in the dentistry and why their treatments are useless and dangerous and can cause more cancer. Then you will find out why you shouldn't use fluoride toothpaste and how you can take care of your dental health and fire your dentist. Dentistry is as evil as Western medicine. Some people know that Western medicine is corrupt and think more about the profit than the patient's health. Dentists are not better than doctors. The American Dental Association is the authority in organized dentistry. It's like the American Medical Association. Both these organizations tell doctors and dentists what kind of protocol they need to follow. Dentists can only use particular dental procedures. The ADA and AMA use a licensing system. So if you don't follow the orders, you can lose your license and can't work as a dentist or doctor. This organization tells dentists that they should not use prevention-minded dentistry. Instead, dentists use all their effort to only treat oral disease and not try to prevent it. Dentistry is a hardware business. It's a billion-dollar industry. Dentistry is all about drill and fill and dentures. So their profits come from fixing symptoms while ignoring oral disease. Preventative dentistry threatens the existence of the hardware dentistry. Both doctors and dentists can only survive financially if there's disease. So they need to make sure that people don't take care of their health in order to earn a living. The corruption going on in dentistry does not only apply to America. It's a global problem. Treating symptoms creates a loop of appointments, medications, and surgeries that creates a fortune for the dental industry. Dentists make most of their money from expensive dental procedures such as root canals. A root canal removes severe pain in a diseased tooth. Instead of fixing the underlying issue behind the pain, the dentist only drills a small hole in the tooth's center through the top of the chewing surface. The dentist then removes the content within the roots of the tooth to sterilize the tooth's canal to avoid bacteria. And then they fill the dead tooth with a material such as gutta percha. Gutta percha is a rubber-like substance that is easy to place in the tooth when the material is warm. Some dentists use a newer material called biocalyx. Even if dentists try to sterilize the tooth, root canals can still cause infections. The tooth has miles of tiny tubules that are impossible to clean without proper blood flow. And since there's no blood left, you cannot treat it with medications. Even if you sterilize the root canals and remove the germs, you can still get energy blockages. Our organs and glands connect to our teeth through the meridian system. Meridians are energy channels that go through the body. This energy is called chi energy. Our bodies work much like a computer. A root canal is the same thing as removing the blood supply and nerves in your arm and then filling it with plastic. Root canals are the only medical procedure that hollows an organ out, stuffs it, and leaves it in our body. Electricity cannot flow through dead tissue. It's like putting a dead battery in your phone. A dead tooth can cause a blockage of the meridian system. And since there's no electric current, there will be problems in your organs because every tooth is connected to a specific organ. That means that a root canal can be the cause of your organ failure and removing it can fix it. The blockage caused by root canals can cause many diseases, including breast tumors. Another problem with root canals is that the tooth becomes brittle when there's no blood supply left, and the tooth can split into many pieces. Therefore, dentists often have to fix it with a crown that can cost several $1,000s. And if they fail, then you also have to pay for extracting the tooth. Root canals are not the only problematic procedure used by a dentist. The most troublesome one is amalgam tooth filling. Amalgam tooth fillings first appeared in the United States in 1833. These fillings contain about 50% mercury by weight. 35% silver, 13% tin, 2% copper, and a trace of zinc. Mercury vapor can come off the dental fillings after chewing, brushing, or eating hot or acidic foods. The following clip shows Dr. Kennedy. He explains how mercury escapes from amalgam tooth fillings.
What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher than the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum. The dentist might send an old gold crown to the dental lab to be welded. How about the dental personnel? They're not being given informed consent.
Mercury is the most toxic natural material on Earth. Toxic tooth fillings are the number one reason why people get sick after visiting the dentist. The vapor from mercury is the most poisonous and can reach your lungs and brain. Mercury can also have a negative effect on fertility and children. Mercury toxicity can also cause heart disease, Alzheimer's, and cancer. According to the ADA, amalgam is safe. Somehow the organization believes that the only safe way to store mercury is in the mouth. There are strict regulations for disposing of mercury. If dentists try to throw mercury in the trash or sink, they can get hefty fines. They need to put the mercury in a sealed container and then give it to a licensed waste company. The weird thing is that the fillings are somehow safe inside the mouth, but the second you extract it from the teeth, it becomes toxic. Mercury is toxic in any amount. We measure mercury in micrograms. So 1,000 micrograms is 1 gram. There's about 4 trillion atoms of mercury in 1 microgram, and only one single atom of mercury is toxic. The average dental amalgam contains about 750 to 1,000 milligrams of mercury. Mercury has a laundry list of symptoms, and the worst one is cancer. Any metal that you have in your mouth can act as a battery, and that can interfere with your brain or heart function. So removing your tooth fillings can have a positive effect on your overall health. You cannot treat cancer unless you treat the mercury, the root canals, and cavitations. But you should only let a biological dentist remove them. These dentists are experts at removing mercury and root canals in a safe way. We have often heard that we need to use fluoride to prevent oral disease. But fluoride is a toxic waste product from the aluminum and fertilizer industry. In some states in America, they put fluoride in the water supply. Getting rid of fluoride is problematic for the aluminum and fertilizer industry. So they convinced some states in America to add fluoride to the water supply. In that way they can earn extra money on a useless byproduct. And the reason why some states add fluoride to the drinking water is to reduce tooth decay. But countries with no fluoride in the water do not have more cavities than Americans. Fluoride interferes with your cellular functioning. Just swallowing 0.5 to 1 milligram of fluoride per day can result in serious issues. It can also speed up our aging process and prevent the production of enzymes. And fluoride can also decrease your thyroid activity by removing iodine, which is vital for the thyroid. Fluoride can also lower your IQ. Most dentists tell us to brush our teeth 2 times a day and use fluoride toothpaste. But fluoride toothpaste does not prevent dental disease. If it did, then no one would have oral disease. Fluoride toothpaste contains a lot of synthetic ingredients that are more appropriate for industrial purposes and not for cleaning your mouth. So brushing your teeth with these chemicals can be harmful to your health. Your body can absorb these chemicals through the mouth's mucous membranes. We shouldn't put anything in our mouth that we cannot swallow. Fluoride toothpaste is a scam to sell a useless byproduct. If you want to brush your teeth, then use baking soda. It's a natural substance that doesn't cause any side effects. We have to remember that our teeth are more than just bones. We need to take care of them like any living thing. One way we can improve our dental health is to eat a whole food plant-based diet and stop eating acidic foods such as animal products, processed food, sodas and white sugar. Your mouth is like a coral reef, and your teeth are the coral surrounded by an ocean of alkaline saliva. By eating a whole food plant-based diet, you can make your saliva more alkaline, and that can reverse dental disease. And every time you eat acidic foods, your saliva becomes more acidic, and that negatively affects your teeth. Another thing you should do is to remove your dental fillings and root canals. Make sure to find a biological dentist that can remove it safely. Otherwise, you can become poisoned by the mercury. And you should also clean your mouth with natural remedies such as baking soda. You can download our natural dental care plan to learn remedies that you can use to improve your oral health. Get this guide now and fire your dentist for good. I will provide a link to this guide below this video. Thanks for watching this video, and I see you soon.